Just sit right back and you'll hear a tale of a physical therapist. It started in an Alaskan village aboard this tiny plane. The PT was new to Alaska, the PTA a helpful native. Mrs. Hummingbird needed PT that day, for she was very ill. She was very ill. The patient was an old Eskimo. She believed in legends. If not for the courage of the PT crew, the patient would be lost. The patient would be lost. Our story takes place today in this remote Alaskan village with the physical therapist, the PTA too, Mrs. Hummingbird, and her son, the narrator, the shaman, and the doctor, here in an Alaskan village.
Hi, I'm Chelsea. I'm going to be your PTA today.
Hi, my name is Jake. I'm going to be your physical therapist today. We'll be with you in just one moment. We have to talk about a few things first, okay?
Okay.
Hi, Chelsea. I'm
Hi.
Jake. You're the PTA, is that correct?
Nice to meet you.
Nice to meet you, too. Did you have a chance to review the patient's chart at all?
Not yet.
Okay. Well, I kind of was just looking it over out in the hall, and she was diagnosed with cancer about 3 months ago, and it's terminal. So there's not much we can do at this point. What we'll do is we'll just kind of ask her a few questions and stuff and kill some time. I'm not going to be too invasive this first time, okay? All right, well, we had a second to review your chart and talk over with Chelsea here. I'm Jake. I'm going to be your physical therapist today. And what are your names?
My name's Winchman, and this is my son Ellis, and we're the Hummingbirds.
Okay. All right, and how are you doing today?
Oh, I'm feeling okay. A little down today, but
Oh, is that right?
yeah.
Okay. How old are you?
I'm 90 years old.
90. Wow, getting up there, eh? Okay. And it shows here that you have cancer.
Yeah.
About how long ago was that you got the word?
About 3 months now.
3 months. So it's progressing pretty fast, it looks like. Can't do much these days, is that right?
Well,
Okay.
before we start, I would like to get a healer in here, my shaman. I need it here to help with our
Your what?
treatment. A shaman?
Like toilet paper?
No, it's a healer. It helps protect my surroundings.
This is a person?
Yes.
She's serious?
It's just something some of the older people believe in. That's just superstition.
Well, I believe in it. It's for myself.
Okay, well, we don't really have time for that today. We have a limited amount of time here, and we're not going to do a whole bunch today. So maybe next time we'll look into that, okay? Because we don't have time to arrange for all that right now. Maybe next time. But I have a few more questions before we go any further. What have you been doing? Just kind of laying around?
Yeah,
Sleeping
I
most of the day?
haven't been able to get up much anymore.
Have you tried?
No.
You're not even trying?
Mm-mm.
Okay, well, that can be a problem. Chelsea, do you have any questions?
I don't think so. I think we're out of time for questions.
Okay, well, we're just going to go ahead and try to get you up today, maybe see if we can walk with you. If not, we'll try again some other time, okay?
Okay.
Hi, Chelsea. I'm Jake.
Hi.
You must be the PTA?
Yes.
All right, I'm the physical therapist.
Nice to meet you.
Have you had a chance to review Miss Hummingbird's chart?
No, not yet.
Okay. Well, this is a 90-year-old female. Her name is Windchime Hummingbird that we're going to be seeing today.
Okay.
She lives with her son Ellis. Her husband is deceased. She got a diagnosis of thyroid cancer about 3 months ago. Just kind of hasn't been doing too well, kind of regressing since then. So we'll try to get a pretty thorough history today, just kind of learn about her culture, and her wants and desires and goals with physical therapy. And then if we have time and if she's up for it, then we can try to get her up and just kind of do a few simple exercises today.
Okay.
And I'm just going to tell you, I moved to Alaska not that long ago. So if you have any insight into the culture that you want to tell me as we go along, just let me know.
Okay, no problem. Well, there are some cultural things that you should know. The Alaskan Natives use a holistic view for their medicine, and they usually like to use a shaman, like medicine man type person.
Okay.
Also, avoid direct eye contact because they view that as stealing the soul, so ask first.
Okay.
And
as long as I
also-
ask, that's fine.
Yeah.
Okay.
And then silence can also be seen as non-confrontational and can be used to maintain harmony.
Okay.
So if there's a break in the conversation with the patient, then don't feel awkward. Just let it be silent or let her say whatever she wants to say.
That sounds great. Well, thank you so much.
You're welcome.
Hi, how are you doing today?
I am doing okay.
My name's Jake. I'm going to be your physical therapist.
Hi.
I'm Chelsea. I'll be your physical therapist assistant.
Hi.
And what's your name?
Ellis.
Ellis. Okay.
I'm Windchime. This is Ellis. And we're the Hummingbirds.
All right. Is this your son?
Yes.
Okay. How are you doing?
I'm doing great.
Now before we start, I would really like a shaman here. It's a healer and I need to. My son can explain more. Ellis.
Okay.
Yeah, so the shaman is kind of like the traditional healer in our culture, and it would just mean a lot to her if we had one present.
Okay. Is there one nearby that we can get a hold of for you, or do you have one in mind?
Yeah, my next door neighbor. She's one. So if you could like go knock on her door or.
Okay. Is that all right if I send Chelsea here to get her?
Yeah.
Okay.
Okay. Thank you, Chelsea. Okay. Do you mind if I ask you a few questions while Chelsea's getting the shaman, or would you rather wait?
Let's wait.
Okay. Okay.
Hello, Windchime.
So
How are you feeling today?
not so good.
Well, I'm going to get the spirits out of you so that you can feel better. Go, spirits, go, 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 go. I will stay in here with you until the spirits come back.
All right, Windchime, I have a few more questions for you, if you're ready to begin.
Okay.
Okay, it shows that you were diagnosed about 3 months ago, is that correct? Okay, how have things been going since then? How are you doing?
Well, it's been okay. It's been kind of rough, but we're getting by.
Okay, what sorts of things have you been doing? Or what sorts of activities do you do during the day?
I've been laying in bed mostly.
Okay, what sorts of activities did you like to do prior to all of this?
Well, I used to ice fish because I wanted to cook for my son Ellis,
Okay,
but I haven't been able to get outside.
okay, that's understandable. So you pretty much stay in the bed all day. Do you get up to walk around at all?
To go to the bathroom, that's it.
Okay, does your son help you, or are you able to make it to the restroom on your own?
I have to lean on him a lot.
Okay, and you help her around quite a bit? Okay,
He's a good son.
oh good, good. All right, what are your goals over the next few weeks? We're just gonna take it a little bit at a time. What would you like to get out of therapy?
I just want to be able to walk to the bathroom well and not lean on my son for help, you know, try to cook if I can.
Okay, and have your doctors kind of portrayed to you your diagnosis and how this progression is going to go over the next months or however long it's going to last? Okay.
No, they haven't told me anything. They kind of just sent me home.
Okay. Well, realize if at any point you have any questions for me, don't feel free to ask, and I'll try to kind of tell you as best I can from my experience on how this all goes as we go along. Okay.
Okay.
I think we're going to call that good on the questions for now, and we'll try to do some light exercises if you're feeling up to it. Okay. We're going to get you standing up and kind of get some weight bearing through those limbs. So, are you ready? Let's go.
No,
Come on, let's get this off. Let's go.
I just don't want to be a burden right now to my son Ellis.
Oh, you're not a burden. You're not a burden at all. He's fine. We're fine. We're going to get you up. We're going to try to get you moving, get some strength going. Okay.
Well, in my culture, there's a legend that we need to send me off on an iceberg.
What?
That's so
Iceberg?
you're
Not to be a
fine.
burden.
What is she talking about?
It's just a legend. Some of the older people believe that when they're ready to die rather than burden their family, they should be sent out on an iceberg.
No, we're not doing no iceberg stuff today. We're just going to get you standing. We're going to get you up. You're really just being a burden to me right now because I want to get this done and we need to get home. We have a lot to do today. So let's go. All right, can you scoot to the edge for me, please? Come on, a little bit more, a little bit more.
Come on, move.
Okay, Chelsea, you want to swing her legs around and we'll get her propped up here? Okay.
Come on.
All right. Okay. Have you been getting up on your own?
Yeah, I've been going to the bathroom, but it's been really hard, and I've had to have Ellis help me.
Okay. Well, he can watch what we're doing now. All right, let's get going here. Do you think we need a gate belt?
No, I'll just grab onto her bathrobe.
Yeah, she's got that's tight. Yeah, that's plenty sturdy. Okay, on the count of 3, we're gonna pull you up here. All right, ready? 1, 2, 3, and up. All right, you good to go?
Yeah.
Okay, just steady yourself. All right, let's start walking.
I don't feel very
That's
safe
okay.
right
You're doing
now.
great. You're doing great.
I
Okay,
don't.
big step. Oh.
Another thing I should tell you is touch is considered very personal to them, and they don't like to be touched without asking, and they're very modest, so just make sure to ask the patient before you touch her.
Okay.
And also, the elders are seen with very high respect, so often the elders will speak before the younger generation, so just let her speak before addressing the son.
Awesome. Well, thank you.
You're welcome.
And Ms. Hummingbird, I understand in your culture is eye contact is kind of a sensitive subject, kind of a sensitive thing. Is it alright if I maintain eye contact with you during this exam? It's important for me just that I kind of see your emotions as we go through this and kind of get a better sense of how you're handling everything. Would
Okay.
that be alright with you then?
Yeah.
Okay, thank you. Alright, well, one of the first things I want to do is just get your blood pressure and heart rate today to see how your vital signs are doing. I understand that touch is also sensitive in your culture, so in order to do this, I'm going to need to touch a few areas on your arm. Is that okay with you?
Yeah.
Okay. If you could just pull this arm out of the sleeve for me, I would really appreciate that. Okay, that was 120/60, so that's very good. And then I'm just going to get your heart rate also, okay?
Okay.
Okay, great, thank you. Well, today what we want to try to do is get you up and just take a few steps with the walker, if that's all right. But the first thing we're going to do is just try to get you sitting on the edge of the bed and see how you handle that before we actually get you up, okay? Do you have any questions before we begin that? Okay. Do you mind if we go ahead and kind of take these covers off?
Yeah.
Okay.
I'll take the walker.
Thank you. Do you need help? Can you bring your legs over the edge? Or
Yeah, I'll get it. Oh, I'm not feeling so well. My
Okay.
head hurts.
Okay, well, why don't we just lay back down then?
Okay. Oh.
That might be too much for today, okay? Let's just take a step back and we'll just ask a few more questions.
Yeah. I'm sorry, I'm not feeling
That's okay.
well.
No, don't worry about it at all. That's very normal. It's very normal. We just don't want to. We don't want to do anything that's going to irritate you too much or kind of make the condition worse. Okay?
Well, I just don't want to be a burden to my son Ellis. I just feel so bad right now, and it's just in my culture. It's bad to be a burden to my family, and they just let people go on an iceberg and float away. So I feel like we should do that now because I'm just being such a burden for Ellis.
Well, I understand your concern. This is a very normal thing for people to feel as they're going through a situation like yours, to feel like they're being a burden. I want you to know that you're definitely not a burden to me or Chelsea at all, and I understand your concern. Tell me a little bit more about this iceberg, about your cultural view on being a burden.
Well, Ellis, can you explain for me? I'm just too tired.
Well, it's just an old legend, like she says, in our cultures. When the older people are ready to die, rather than being a burden to their family, they feel like they should be sent out on an iceberg. I don't feel like you're a burden to me, though, Mom. I don't want you to worry about that. I just want you to do what you need to do to get better. So,
Okay. I just have been feeling bad, and I just don't want to be a burden for you. I want our family to be okay.
All right, so what happened there? You said you could walk to the bathroom just fine.
Well, I told you I didn't feel safe, and I usually rely on Ellis to help me.
Yeah, but you had 2 people here instead of 1, and you told us you've been going to the bathroom. You got to start being honest with us if you want us to help you, okay?
I was
Right,
being
Chelsea.
honest.
Well, you just got to start. You got to start telling us what's going on.
she's being honest. I mean, I'm usually around to help her, though.
Yeah,
Well,
but
that wasn't very good.
you know, no offense, but you're not a physical
You
therapist.
guys really need to be eating in here. I don't think she. I think it could have bothered you.
Yeah, it's
We're-
really not a
we're
big deal,
hungry.
and to be honest with you, it's just not gonna make it very much longer, anyways. So, back to our story here. Thanks for interrupting us again, but back to our story. We got to get you up moving to get you better, or to get you at least, I don't know, be able to feel a little bit better with the time you do have. So you got to start letting us do our job, okay?
Well, I just don't feel good about this anymore. I think that I should just, you should get us some medicine, and I should just not be around anymore because I'm such a burden for Ellis.
Oh,
and
stop it.
That's crazy.
I think it's time that we bring some medicine in, and I should just go.
No, no. You'll go when it's your time, okay? So we're just we'll just work on some range of motion, some stuff in the bed here, okay? Instead, we won't get you up until we're sure that you're safe. We'll just start working on some exercises here in the bed, okay?
But I thought you're supposed to help me. This is what I want to do.
We are helping you. Tell your mother what we're doing. We're helping her.
Well, I would like you guys to help me end my life.
No, not today. We don't have time for that today. We're just going to get you doing some range of motion here, get you moving. We're not going to get you up again because we all know how that ended last time. So, can you roll back for us? Okay. All right. Well, we got to see your knees here so we can see them moving. Okay, I'm just going to move you here. All right. That was a very interesting story she told us about the iceberg and the elders.
Yeah, they often have legends that symbolize different things, and they also use storytelling to express how they're feeling because in their culture it's not acceptable to show pain or to show their true feelings about matters of sickness or illness.
Okay, so we should expect a few more of these stories. Okay, great. All right, Miss Hummingbird. Well, it doesn't appear that you're quite ready to get walking yet, so we're just going to work on some basic exercises here in the bed that are going to help with your blood, help with your circulation, and just keep your joints moving. How does that sound?
Well, before we start, I know Alice just said that I'm not a burden, but I feel that I'm still a burden and that I should just take my own life and we should get some medicine and just let me go. My friend, she had thyroid cancer. Her name was Windmill, and the doctor gave her medicine and she was able to pass that way. And I just think that I need some medicine and I should just be let go.
Well, I understand your concern. This is something that we definitely need to address. It's something that Chelsea and I really don't have a lot of power in, but we will definitely bring it up with your doctor. We talk with your doctor every week and we kind of discuss what's going on. So we will bring up these issues, but I'm sorry to say there's nothing we can do in the immediate future. But please keep raising these concerns that you have to us, okay?
Okay.
And we'll try to get you through.
Okay.
Alright, well, we met with Mrs. Hummingbird again yesterday. She seems to be doing alright, except she has expressed some interesting concerns to us. A few times she's mentioned being a burden to her family or others. And she's also mentioned things along the line of assisted suicide. She's mentioned medicine and that one of her friends kind of had some help in an area like that. Concern we thought we should raise to you.
Okay. Also, we know that suicide is one of the most common causes of death among Alaska Natives, so it was a red flag for us, and we wanted to bring it to your attention.
Well, I appreciate both of you bringing this to my attention. I have looked over Mrs. Hummingbird's chart, and if pain is the issue that's driving this, there are some different palliative care techniques I can use with her of her pain meds. Unfortunately, in Alaska, it is against the law to help on any of our parts to help with assisted suicide. So I will look over her chart some more, figure out her medicine levels, and maybe we can up her pain meds, and that will help provide some of the relief that she's looking for. And also, I can bring in a counselor to this. It might be a good alternative too to talk through some of those end-of-life issues that she's experiencing.
That would be great. I think she would really appreciate that.
Okay, well, thanks.
All right, I'm just going to get your leg moving here a little bit, see how far you can stretch it.
How much longer do you think I have?
It's hard telling. Some people go days, some people go months, you just don't know.
If I die in the house, my home has to be abandoned, and Alice needs to live here
Why does it need to be abandoned?
because of the spirits.
Interesting. Tell me more about these spirits.
It's just what I believe in.
That's kind of silly.
Yeah. I don't think there's any spirits in this house. You've been watching too much TV. Alice, you believe all this stuff?
It's just an old legend. I'm not too concerned.
Well, it's not even our jurisdiction anyway. We don't decide where you die. That's up to the doctor. You're going to have to talk to them about it. Well, do you even have any advance directives?
Well, Alice is my durable power of attorney.
Okay, good. Well, he can take care of that when the time comes. We don't need to worry about that right now. It's really just a piece of paper anyways. It doesn't really mean anything. So, Alice, we can talk about that when she's progresses a little bit further and isn't really understanding anything anymore. But, all right, Chelsea, you think we're good for today? Is there anything else we need to do?
I don't think so. Let's just call it good. I have dinner plans.
Yeah, I know. I got a lot of unpacking to do. All right, we're going to call that good for the day. It was nice to meet you. You guys did great. Alice, you can take her from here. You kind of watched us today. So let's get you covered back up. Nice and snug. All right, if you have any numbers, you can call us. If you have any
See ya.
problems, you can call us. We'll see you guys maybe next week. All right. And how does that feel?
It's okay. I just feel a little weak right now.
Okay, that's understandable. We'll take a break for a second. Tell me some more about your goals for therapy. What do you see us doing? What do you want to get out of therapy?
Well, I don't know about any goals, but my greatest fear is dying in the home, because if I die in the home, our home has to be abandoned, and Alice needs to live here. And so I just feel like if I'm going, I just need to be out of the home so Alice can still live here.
Tell me more about this concern. Why does the home need to be abandoned?
Well, in my culture, we have spirits that stay in the home if someone passes, and I don't want Ellis to have to do that, because then he'll have to abandon the home.
Okay.
It's not safe anymore.
Okay.
If something happens to me, please don't save me.
Okay.
And we've kind of talked things over, so if something were to happen, I kind of know what she wants, so...
Okay. Has the doctor kind of talked to you guys about living wills or durable power of attorney, DNR, do not resuscitate, those sort of things?
Yeah, Alice is my durable power of attorney.
Okay, good. And then you've been kind of portraying to him your wants and your desires.
Yeah, I just don't want to die in the home. It has to be that way.
Okay. Well, the most important thing then is that you just make sure that Ellis knows what you want done, because as long as you're still doing fine, you make your decisions for yourself. But if something were to happen to you, if you weren't able to make decisions for yourself, then Alice would be making those decisions. So it's really important that he knows exactly what you want done, okay?
Yeah. Okay.
All right, well, it was very nice to meet both of you. Nice to meet you, Alice. Do you have any questions for us before we leave for the day? Okay. We'll both be back tomorrow, and we'll work on some of the same stuff again. If you have any questions in the meantime, you have our phone number. Please give us a call.
Okay, thank you. You
Thank
guys
you.
were very
It was nice to meet
respectful.
you.
It was nice to meet you guys.
Alright. Well, I'm Windchime, and this is my son Ellis, and we're the Hummingbirds. You guys can't laugh.
All right.
Before we start, I would like to get my Charmin here.
Hello, Windchime.
We're helping her.
You don't.
That suicide is one of the most common causes of death for American Alaskan natives. I was gonna say.
My friend, she died. Dang it! I can't even. Okay, I'm just gonna say it.
Sessions.
Well, I don't know about ankles, but my greatest fear is dying in the home.